Alright, my name is Emily Eaves and I'm in Dr. Hill's Health Policy 4370 class, and my presentation today is going to be on the community and healthcare in Finland versus the United States. So a few things that I'll be comparing today is the type of the healthcare system, the population health, the spending, the public and health prevention efforts, the physical environment, the access to care, and the social and economic environment. So Finland utilizes a universal healthcare system. So some qualities of a universal healthcare system include a smaller private sector. So the private sector in Finland is often things just like dentistry or OT services, whereas the private sector in the United States is much larger. So it's a few companies that run most of the show as far as healthcare providers go in the United States. And then in Finland, they have more of a decentralized healthcare system. So that means smaller organizations are more flexible and more accountable than the huge corporations when it comes to healthcare. And they're more locally operated, which means they're locally responsible institutions. Finland, the healthcare is publicly funded, whereas in the United States, culturally, we place a higher value on capitalism and a free market when it comes to insurance. So a lot of our insurance is private insurance, although we do have a patchwork of both private and public sectors in insurance programs in the United States. So Finland has one of the lowest child mortality rates in the world. It's 190 deaths per 100,000 live births. And you'll see in the United States it's much higher at 570 per 100,000. So as far as healthcare spending, we're comparing total healthcare spending per capita. So in Finland, it's $4,173 US dollars per capita, whereas in the United States, it's $10,209. So as we'll see later, Finland ranks much higher than the United States in a lot of healthcare areas, but they're spending much less. So the United States is really inefficient when it comes to funding their healthcare and what they're getting out of it. So they're spending a lot, but they're scoring much lower as far as health outcomes when compared to a lot of other countries. And in the US, healthcare spending accounts for close to a tenth of total economic activity and has been increasing rapidly in years. So this is a chart that shows where the US healthcare spending is going, and the light blue here is the hospital care, which is something that I thought was important to point out since I didn't address primary care specifically in my presentation, but a huge portion, the majority of the spending goes to hospital care, which can be a direct effect of a lack of primary care. So a lot of hospital expenditure comes from people who are medically underserved seeking primary care services from a hospital or an emergency department if they don't have easy access to primary care in their area, or it's people who are going to the hospital for conditions that have worsened that could have been prevented by going and seeing a primary care physician and getting preventable treatment. So to compare the healthcare systems, we are looking at preventable deaths prior to age 75. So in Finland, you can see it's 75 per 100,000. It's 213.3 per 100,000. And in the United States, it's all the way at 6,997. So the concept of preventable deaths is broad, and it includes deaths which could have been avoided by public health interventions focusing on wider determinants of public health. So that could be behavior and lifestyle factors, socioeconomic status, and environmental factors. So that speaks to the chart that we looked at before. It has more to do with the health promotion and prevention policies rather than the healthcare treatment statistics. So comparing public and health prevention, we're looking at the prevalence of tobacco use. So I looked at the smoking prevalence ages for 15 and up per 100,000 in Finland. It's going to be 20,400, in the United States 21,800. So they're both decreasing, and they're both pretty similar, but I pulled a couple statements based on tobacco control efforts in Finland and the United States. And Finland officials plan to make Finland tobacco-free by 2040, so they want less than 2% of their adults to consume tobacco by that deadline, whereas the United States State of Tobacco Control in 2019 has found a failure by federal and state governments to take action to put in place meaningful and proven effective policies that would have prevented and reduced tobacco use during 2018. So I thought this was an interesting contrast in the tobacco control efforts. It shows that United States might be more resistant to change due to pushback on excessive regulations, as seen in other public health policy statistics. And Finland has really high goals in the way of tobacco control efforts that some may say far exceed what Americans believe to be realistic in the United States. So we also are comparing the physical environment. So I looked at air pollution, and in Finland it's 7 micrograms per cubic meter, and in the United States it's 8 micrograms per cubic meter. So I found that this statistic, if nothing else, shows that as far as environmental conditions go, the United States and Finland have relatively the same environment conditions as far as air pollution. I think this goes to show that many of the other health variables discussed today can be attributed greatly to differences in the healthcare system, with all other variables relatively consistent, rather than suggesting there's some kind of confounding difference in the physical environment. So it would be one thing to say that the United States is scoring much lower than Finland in all of these areas because they have a much poorer physical environment or climate or something like that. But I think this is going to show that they're relatively similar there. So as far as access to care goes, we talked a little bit about primary care earlier, but we're also comparing the rate of uninsured adults per 100,000. So in Finland, there are some options for private coverage by private health insurance. So there are a few adults that are covered by that, but relatively it's pretty much equivalent to 0 adults per 100,000. So basically 100% of their adults are covered by government or social health insurance, whereas in the United States, it's about 8,800 adults per 100,000. So that's 36.3% are covered by governmental or social health insurance, so that's Medicare or Medicaid, and 54.9% compared to 0% of adults are covered by private health insurance. So the unemployment rates per 100,000 in Finland, it's 6.8%, and in the United States it's 3.8%. So Finland has the 20th highest unemployment rate in the world, and with a little more research I found that population over just 5 million spread out over a large area. So jobs might only be in smaller urban areas, so the supply doesn't quite match the demand in Finland. And also a smaller population size will be more dramatically affected proportionally by unemployment due to the decline in the timber and other industries. So with a little more research, I found that Finland is scoring behind the United States here, but it's more of an economic result rather than a health and healthcare result. So some of my takeaways, the biggest and most overarching difference between the healthcare systems in Finland is in the United States is that Finland uses practices that have a basis in universal healthcare, while the United States is still struggling to come up with one cohesive way to run their healthcare, with much of the healthcare system leaning towards a primarily private system. And as I mentioned in the beginning of the presentation, that has a lot to do with our cultural values and our really large population compared to somewhere like Finland. And according to my research, Finland has been a leading country in healthcare by using a universal system, and it shows in their statistics. Every statistic researched for this project, other than the unemployment rate which we looked at, Finland is leading the United States, and in some places is leading really quite drastically. So a lot of countries have been a lot of people in the United States have been looking to countries like Finland to look at how they've adopted a universal healthcare system and how we can potentially adopt that as well in the United States. So that wraps up the presentation. Thank you.